This segment has been paid for by the participating business.
If you've ever thought about ditching those glasses and getting laser eye surgery but had some doubts about its effectiveness, Dr. Leonard Newman is here to clear up some of the myths about Lasik.
Yes.
Laser eye surgery. Welcome, doctor.
Good morning.
So, are they interchangeable terms, Lasik?
Yes.
Laser?
Yes. Laser vision correction, Lasik. They're essentially the same procedure, and that is a 2-minute procedure that corrects astigmatism, nearsightedness, farsightedness in probably 90% of the population.
Okay, so 2 minutes. That's it. Out.
Two.
Does it hurt?
No. It's a great question.
That would be my first question.
I think the biggest barrier patients have, they, I can't put in eye drops. I'm really nervous. I can't even put in contacts. It's done with an eye drop. It feels like you're rubbing your eye for about 3 seconds. And the difference between sort of making it real easy for the patient and just getting someone through it, sort of talking them through it, saying, all right, it's going to feel like you're rubbing your eyes for a couple seconds.
I mean, do you face people with a fear factor saying, I've been dying to do this, but just the whole idea of messing around with my eye?
Yes. They sit up from the laser. The first thing they say, I should have done this years ago. And that's really rewarding to us.
Okay,
it's really nice to hear that.
So the correction is, how long does it take to actually see a difference, so to speak?
Yeah. If you wear Coke bottle thick glasses, you will sit up from the laser and see a clock across the room. And that's probably the majority of patients. But overnight, most people are driving, most people are back at work. There's sort of this misunderstanding that I need the weekend to heal up. It's really not the case. Overnight, you can really expect to have a normal day.
I'm just envisioning you're laid up and you have bandages all wrapped around your head and whatnot. No.
No, not today. These days, you leave with a set of sunglasses. You can actually see pretty well. Someone should drive you home. You head home, you put in your eye drops. They're roughly every 3 or 4 hours. And you sleep through the night. And the next day, we check your corneas. And like I said, you can plan on having a normal day.
All right, but Dr. Newman, you got to admit, I mean, things have come a long way since LASIK was first introduced.
They have.
Talk me through that.
Yeah. Some of the biggest changes, the safety, the way we make it more comfortable for patients. These days, the lasers follow your eyes during the treatment. One of the common concerns I have, patients say, how am I going to keep still during that procedure? Most treatments are under about 20 seconds. That's the actual laser time. During that time, the patient's looking at a little light. You don't see anything strange.
So you're not asleep. You are awake.
You're awake, but sedate. Sometimes we give a little Valium. It's like having a glass of wine. And you're looking at a little red light, and the laser's actually following your eye. So it's nice to hold still. But realistically, everybody moves a little bit, and the lasers actually adjust for that. That's a new technology that actually adds a lot of precision to the procedure. And I think it's very comforting, to know that if I move, you're not going to laser my eyebrow. It's nice to know that.
Well, of course, there are a lot of lasering that people do on their faces, but we're not talking about this. This
we
is
want to correct the
specific for
vision.
And you've been doing how many? I mean, just overall, there are millions of laser eye surgeries done
in the U.S.
Right?
Oh, yeah.
And you've done how many?
I've done about 45,000 procedures, and I operate about 5 to 6 days a week. It's something I enjoy doing, and our mission statement in creating this office was, let's make it affordable for everybody.
Okay.
And so
Yale trained.
Correct.
And you are making it more affordable.
Yeah.
I mean, some people see this and they go, well, affordable, where's he, cutting corners?
Yeah.
How do you do this?
Yeah, it's a simple equation. We invested in this technology, and it doesn't have to cost $5,000. It really doesn't.
So you're basically cutting out the middleman because you're doing it all right there.
Correct. Yeah, everything's done in our office. The preoperative evaluation, all of the follow-ups, the surgeries, it's all done there. And with that model, we can really make it. And we also have 2 years interest-free payment plans. I mean, we can divide out these payments. Realistically, most people spend more on their cell phone bills. I mean, it's
okay. It's an interesting way to look at it. So you have offices in Sacramento and Hercules.
Yes.
I also understand you speak fluent Spanish.
Sí, correcto. Sí, quiero invitar a los pacientes españoles para un examen complementario para ver si eran candidatos.
Okay, and translated?
I invite our patients in for a complimentary LASIK evaluation to see if it's right for them. And we're open in the evenings. We have convenient appointments on Thursday evenings, Tuesday evenings. We're open on weekends.
And also the special offer for our viewers today.
Yeah.
Really briefly.
Yeah, we $899 per eye. That's a traditional technology, if that's the appropriate technology for you, and $200 off custom wavefront treatments.
If people are interested, they can just call your office or go to the website.
Yes.
Thank you so much for being here.
Thank you, Vicki.
This segment has been paid for by the participating business.